Your doctor has asked you to watch this presentation on lateral epicondylitis or tennis elbow because he or she thinks you may have such a condition. Tennis elbow or lateral epicondylitis usually presents with pain over the lateral epicondyle, which is this here, this outside part of the elbow, and it may refer into the forearm. The pain is due to a problem with the muscles or their attachment in that area. Now, in that area, there are a number of muscles that attach to the bone and are anchored there, so that when you perform certain activities, those muscles come into play, and if they are inflamed or damaged, they may be painful. Now, lateral epicondylitis can be the consequence of trauma, a single major trauma like lifting a very heavy weight, but it's more often related to repetitive activities. Sometimes it's activities that you're unused to doing, such as a lot of gardening or painting or something like that. The pain is usually aggravated by activities such as twisting or rotation motion, or gripping, such as gripping a carton of milk. The pain is usually reproduced if you cock up your wrist like so and keep it while trying to force it down. That should reproduce the pain along here. Or if you hold up the finger and again stop yourself moving it down, that should reproduce the pain. And they're the sort of symptoms one sees with lateral epicondylitis. Sometimes your doctor will give you painkillers or anti-inflammatory drugs or even an injection. But even if these are given, these exercises I'm going to suggest to you will be extremely useful, and sometimes these exercises alone will be sufficient to get you sorted out. There are stretches and strengthening exercises for lateral epicondylitis. So the stretch is quite simple. Lock out the elbow, bring down the wrist and hold, and with the other hand press in. You could feel the tightness on this side of the arm. Hold for 5, relax for 3, hold for 5, and relax for 3. And you can hold that up against a wall, or you can hold it with your other hand. And that's the stretch. That stretches these muscles here that are tying into the lateral epicondyle. You also need to do some strengthening exercises, and they're again pretty simple. Start off, fix the forearm and use your hand against gravity as the weight initially, and if that's comfortable, as it often will be, then you can add some weight. I'm using here a bottle with water in it, and you can vary that weight depending, and you can find different kinds of weights in the house. You lift it, hold 1, 2, 3, 4, 5, and relax down. 1, 2, 3, and lift again and hold, and that should be repeated about 10 times, and you should feel a little bit of fatigue here in the forearm muscles as you're doing it, and that should be sufficient. You also need to strengthen the pronators, and for this again we use the bottle over the edge, fix your forearm, and you roll the hand from one side to the other and hold 1, 2, 3, and the other way 1, 2, 3. And as that gets easier, you then can lengthen the bottle or increase the weight, and that gives more work for the pronating muscles to work and strengthen them further. And that program of stretching and strengthening will promote healing, reduce the amount of symptoms you're having, and reduce your chances of re-injury. You should repeat these exercises twice daily for a number of weeks, well after all your symptoms have settled down, and strengthening those muscles will permit you to be able to undertake these activities again without a fear of re-injuring yourself. If your symptoms persist or don't behave in the way I expect them to behave, in other words, don't improve, then you should revisit your doctor for just confirmation of the diagnosis, and you may need to go to see a physiotherapist for more expert treatment than I can give you through this medium.